So that's the case. The lady is the delivered woman, 53 years old. Her requirement is about near vision for reading the microphone to collect products, and the intermediate vision for the navigation holder on the e-bike to drive, and the distant vision for drive the e-bike in the normal time. Her received the Microlens 2.25 diopters. And before surgery, she had very robust visual acuity for distance and the bad near visions. And the distance refractions is 1.75 and 1.25. And for near, 3 point diopters and left eye 2.5 diopters. The pupil diameter is very important to check the size of the pupil size. For the photopica and the scotopica, 2.5 and 4.5, 2.5, 4.4. And very good corneal chemistry and very normal P value, and addition 1.25. After the surgery, we can see the day one, the non-dominant near vision quite better, but for distant visions decline a little bit. But 0.5 is better for both eyes to see far and near, so she's very happy even after day one. He go to back work after 1 week, keep the normal working. So after 3 years, 3 months, I think the non-dominant near visions improved 2020. Both eye 2020 for distant and near visions. But non-dominant eye for distant vision still keep the 1.5, but doesn't matter for her work. So the imaging for the location of the strategic Microlens is quite good, and with clear cornea, the anterior OCT show the location under the MC about 294 micron. The confocal microscope show the no information around the Microlens up and down. It's very kind. And also in the slims, their density is quite good compared to pre-op. And OCT also show the pre-op lab and after surgery 3 months lab. We can see, I think I'm curious about spherical aberrations. I'm not sure. Spherical aberration before surgery, 0.7. But actually after the 3 months, 0.3. Quite good. And the central, just like central island, make the create the near addition effect in the central cornea. And also the refraction pre-op. Also. The refraction pre-op and after is quite stable and see. So contrast sensitivity, so visual quality is quite important for these populations. As the dark, at the glare condition and the dark conditions, this is the dominant eye and the non-dominant eye, the both eye, and the dominant eye, non-dominant both eye, very good outcomes. So this picture shows the normal condition, the delivery woman to work with for the near side collect product and the intermediate solution for the navigation and for these things. And this the woman's feedback is very happy for near vision and comfortable reading the standard size text on the mobile phone. For intermediate visions to read more from phone sticks onto her e-bike holder, and for distant activity to work and write very easy as before surgery.